Today we'll discuss about a very common shoulder condition called frozen shoulder. Frozen shoulder is a condition where a shoulder becomes very painful and stiff. Movements of the shoulder become reduced, sometimes completely frozen. It is thought to be due to scar-like tissue forming in the shoulder capsule. Without treatment, symptoms usually go, but this may take up to 2 to 3 years. Various treatments are used to ease pain and improve the movement of the shoulder. Then, who gets frozen shoulder? Frozen shoulder affects about 1 in 50 adults at some stage in their life. It most commonly occurs in people aged between 40 and 60. It is more common in people who have diabetes. Either shoulder can be affected, but most commonly it is the non-dominant shoulder. Then, what are the symptoms of a frozen shoulder? The typical symptoms are pain, stiffness, and limitation in the range of movement of the shoulder. The symptoms typically have three phases. The phase 1, the freezing or a painful phase. This typically lasts 2 to 9 months. The first symptom is usually pain. Stiffness and limitation in movement then also gradually build up. The pain is typically worse at night and when lying on the affected side. Phase 2, the frozen or stiff phase. This typically lasts 4 to 12 months. Pain gradually eases, but stiffness and limitation in movement remain and can get worse. All movements of the shoulder are affected, but the movement most severely affected is usually rotation of the arm outwards. The muscles around the shoulder may waste a bit as they are not used. Phase 3, the thawing or a recovery phase. This typically lasts 5 to 12 months. The stiffness gradually goes and movement gradually returns to normal or near normal. Symptoms often interfere with the everyday tasks such as driving, dressing, or sleeping. Even scratching your back or putting your hand in a rear pocket may become impossible. Work may be affected in some cases. There is a great variation in the severity and length of symptoms. Untreated, on an average, the symptoms last 2 to 3 years in total before going. In some cases, it is much less than this. In minority of cases, symptoms last for several years. What are the treatment options for frozen shoulder? The aim of treatment is to ease pain and stiffness and to keep the range of shoulder movements as good as possible while waiting for the condition to clear. Anti-inflammatory painkillers. You can take paracetamol, aceclofenac, or diclofenac or any other painkiller tablets after consulting your physician or an orthopedic surgeon. Shoulder exercises. These are commonly advised. The aim is to keep the shoulder from stiffening up and to keep movements as full as possible. You should do the exercises at least half an hour in the morning and half an hour in the evening. The last option is surgery. We should think about the surgery only if there is no improvement with the medications and regular exercises. Operation is sometimes considered if other treatments don't help. Techniques that used include manipulation. This is a procedure where the shoulder is moved around by a surgeon while you are under anesthesia. Arthroscopic capsular release is a new keyhole surgical technique. This is a relatively small operation done in keyhole manner. It is often done as a day care procedure. In this procedure, the tight capsule of the joint is released with a special probe. One recent research study showed that this procedure gave about 8 in 10 chance of greatly improving symptoms. Because of the encouraging results of this research study, it is becoming more popular treatment.